Hello and welcome to this episode of Let's Talk, where we zoom in on the practical implications and the next steps around the bigger session in this EAO Congress. And in this one, we are talking about the role of orthodontic tooth movement in the treatment planning. And I'm very proud to be joined by a chair of that session, Kathrin Becker from Germany. Kathrin, welcome.
Thank you for the kind invitation.
And one of the three speakers is also here, Manuel Nienkemper from Germany as well. Welcome, Manuel.
Thank you so much.
Now let's start with the basics. We are in an implantology and perhaps somewhat periodontology congress, yet we have a big session on the role of orthodontic tooth movement. Kathrin, why are we talking about this topic here today?
I think the interdisciplinary treatment planning becomes more and more important. With invisible appliances, we can also invite adult patients to have an orthodontic treatment. And with aligner treatments, we do per definition a setup. This facilitates the communication. And therefore, it's now becoming more and more popular to have the final detail of the entire treatment perfect or done in a perfect way. And that's the reason why these two disciplines merge more and more. And I'm really honored to be here also for an orthodontic session this time.
Exactly. It's a big session. So you say two things. Interdisciplinary is on the rise, so somehow everybody is coming out of their towers and realizing, whoa, we are with multiple professions in the same oral cavity. And you say there's a new possibility to now also treat adults with orthodontics. Apparently, the aligners make it happen because otherwise you cannot put a traditional retainer on an adult, I understand?
No, but I think most adults, they don't want to have the conventional braces or even colored elastics in their mouth. I think
because it makes them look too young.
Yeah, exactly. And with invisible treatments, I think they are much more open to this kind of treatment, and they seek a more perfect outcome in the end.
Yeah.
We see also additional advantages when we combine, for example, periodontal treatment. There's now some evidence coming up with orthodontic treatment, especially when we have this pathological tooth movements. It's a great advantage to combine the two fields. So it's an emerging discipline, but it's getting more and more relevant to us.
Yeah, exactly. And that leads to the fact, Manuel, that you are now, as an orthodontist, for the first time ever, a speaker on stage in the EAO Congress. Why do you feel it's important to bring your message to this population?
Yeah. Kathrin already mentioned one point. We can do more nowadays. And of course, if we want to work together, we have to know what we can do for each other. And so it's very nice to be here and to show what we can offer to improve the treatment, even the surgical treatment. And aligners, they can do more than they could 10 years ago. But also one thing, and this is what I also want to highlight, is we do more and more kind of hybrid treatment, we call it. In the past, there was fixed appliances, or there were aligners, and nowadays we combine this. For example, if you use the skeletal anchorage and have a partial mechanics for the complicated thing, you can do the rest with aligners. So for the patient, it remains more or less invisible, even though we're doing complex things in the back.
Exactly. And for our viewers who are relatively new in the field, skeletal anchorage, what are you doing?
So the problem if you want to move a tooth always is you have a counteracting force in the opposite direction. So if you want to move this tooth and you anchor on this, you will not be able to do this. This will happen. And if you want to avoid this, you have to anchor your force somewhere else. And what we do is we do a temporary tiny implant somewhere else, preferable in the upper, for example, in the palate. And then we can anchor these forces on these implants to avoid side effects. And so we can do asymmetric things and we can be much more precise. And Kathrin already mentioned the digital planning. So we can be much more precise. If you know the rest is not moving, but this will move this way, you can better plan the whole thing in the beginning. It's much more predictable.
Exactly. So more predictable outcomes. Now, the role of orthodontics in treatment planning, where is it? What is the key asset? And probably it's not to say in general, but what are some of the low-hanging opportunities?
So I think it's very important not to place the implant first and then send the patient to the orthodontist and ask, okay, and now I have some things that should be improved it's very important to do the interdisciplinary treatment in the beginning. And there has to be a 3D orthodontic treatment planning and also a 3-dimensional prosthodontic treatment planning. And then we can see what are the spaces that are needed. The orthodontist can say what is possible in terms of anchorage, if we need additional anchorage. Maybe we can also use the dental implant as an anchorage if it's placed in a strategic way.
Yeah. So it's not a general first orthodontics, then implantology.
No.
It could vary, but as long as you make the plan together.
We have to make the plan together and see what is the best strategy in terms of efficiency, in terms of happiness for the patient. The patient doesn't want a treatment that takes 6, 7, 8 years. The patient.
Yeah, because that's my next question. I mean, I've had the privilege to go to the orthodontist in my youth. This takes years. So what does it mean for the treatment plan and the length of the whole procedure, so to say, from a patient perspective, if the orthodontist gets involved?
Yeah, of course. First of all, the length of the treatment depends on what you're doing.
Of course.
But even if you do it in the smartest way, you cannot speed it up endlessly. So it takes time.
Yeah.
Especially because of that, a plan that is done in the beginning together is very important. Sometimes some things can be done simultaneously if we know what we're doing together. Yeah. And it's even much more important, as we mentioned, is to even solve the complex things more or less invisible. So that is not a big burden for the patient. We have to see that the aesthetics also is acceptable to very good even in the course of treatment.
During the treatment. And that's why you both say both the skeletal anchorage, so the temporary implant solution, and the aligner braces now kind of create this opportunity to do this.
Exactly. So we have great provisionals also that can be combined. For example, if you have an anterior lateral missing, so you can have a skeletally anchored temporary provisional crown over there. You do the other mechanics behind. You optimize, for example, the size of the gap. And then the patient doesn't really see that they have the orthodontic treatment behind it.
Yeah.
But in the end, you have the much better outcome. Because you have to consider, if you have, for example, a growing patient, they are really challenging to us. You have the areolar growth. If you just place an implant, the size of the anterior gap is not ideal. You will not have the ideal outcome afterwards because the other teeth, they are moving a little bit more to the occlusal plane in that direction. The implant might be in a slight superposition. And if you want to have it perfect, and details have to be considered to make the entire treatment perfect.
Exactly.
And you can do it just if you have this interdisciplinary treatment approach.
And details make perfection. It's the theme of this Congress here in Milan, of course.
What I wanted to
All right. So
highlight.
the message is clear, a more interdisciplinary approach, being aware that we are now in an era where this is more feasible also from a treatment bearable perspective for the patient. So the real question is, what is the biggest challenges we need to overcome out there to make this a clinical reality? What are some of the things that are blocking this wonderful cooperation?
I think the problem is you need an interdisciplinary treatment team.
Yeah.
And this can be quite challenging because in dentistry, we are used to have our own practice. The orthodontists are used, we do a lot of orthodontic treatments, but they are usually not used to communicate so much about treatment plans with other specialties. The other specialties have the same problem, especially in Germany. So they are not used, consult an orthodontist to operate my molar to see, do I have enough vertical width to do it? Do I have to intrude maybe an elongated tooth that serves as an antagonist? They might just extract, place an implant, place another implant. So this communication is missing at the moment. And I think this is a great opportunity also of the Congress to show that we communicate. We can do much more biologically for our patients.
Exactly. Emmanuel, how is that in your practice?
The first thing is it's also a matter of trust. Because if you send a patient to the orthodontist, even though you discussed, you won't see them for maybe 1.5 years. And so you have to trust that this patient will be sent back. So we have to build up this trust to have really a permanent team.
Mm-hmm.
Yeah? And also the dentist has to see the benefit out of this. So going to the congresses like this, see what we can do for them so that they really see it's better. And
is it necessary to formalize this type of cooperation, or how do you do that?
I talk to the dentists. I talk to this, of course, in my area. I also give lectures and invite them to see this, because you can only.
So that, I guess that's a practical takeaway. So you make yourself known, visible, and in that way build your trust and network, at least locally.
Yeah, and I know Kathrin and me, we are also associated to universities. So the dentists, they go there for seminars or for something. So maybe this makes it easier. Yeah. But the next problem we have, especially in Germany, I don't know how it is in all the other countries, is the patients are referred often, many times, to the orthodontist. And of course, then you send them back. And if this dentist is not an expert for periodontists or for doing the nicest ceramic veneers, you cannot just send them somewhere else, because they will never send the patient back. And so it's also a lot of communication. Yeah, this is real life. Real life in private practice.
So it's also a call or a realization, but it's almost unsolvable, that a certain professional cannot be and do everything, right? And know your limitations.
But the better you know the dentists, they are open to say, I don't do these high aesthetic veneers, maybe if you have a specialist. But again, this needs trust and communication.
Yeah.
In the end, it's all, let's talk.
Exactly. It's all let's talk, like we do right now. And I guess it starts with the awareness. Yeah. That is something that we're working on right now. But there's another step that needs to be done, Kathrin.
Yeah, I think what I'm realizing also now in Berlin, you have really good dentists you work with, or also maxillofacial surgeons you work with. And with them I can discuss, we need this and this and this. And then it's getting really nice, because you have this kind of collaboration and this vision that we need specialists in the different areas. If you're not the specialist for the veneers, you should not do it.
Yeah.
There is a patient, okay, it could be maybe something temporary that I'm doing, but then the other thing.
So you say we need regional networks of specialists within all the disciplines that treat patients orally.
Yeah, and I think nowadays, also with all the digital technologies, it's getting much more easy, because we don't need this outdated meetings with the patient, where the patient sits on the chair and then the doctors discuss next to him what to be done and take some records. We have everything digital.
Exactly.
Sometimes we have even a facial scan, so we can visualize everything and discuss it behind, and then communicate just the final treatment plan with the patient. And this is also something which makes it for the patient much more comfortable and easy to trust. Because if the patient sees doctors discussing, this is what we sometimes do. We have some debates, what is best.
Yeah.
The space closer together.
So in your session, Renato Coccioni was talking about this interdisciplinary digital planning. We had another session on digital planning where we saw, it creates new opportunities for better outcomes. But now you say, no, wait a second, there's a whole new opportunity. We can actually be much more sharing that data around that patient, and much more eyes looking at the same information.
Yeah, exactly. I think digital planning has some history, but the problem was prosthodontists did it in their way. Then there was the communication or combination of implantology and prosthodontics. But now we have to combine maybe a periodontal treatment with the orthodontic treatment, with the implant treatment. Everything needs some connection in the software. Excellent. And this is really difficult. So we need the options to export it, to import it in another software, to visualize everything, and to have a complete treatment planning. And even nowadays, from my experience, the software that we have available is not complete, not perfect for this.
Exactly, for the sharing specifically.
For the sharing and for the interdisciplinary planning, because then you export your plannings.
The special tool of the other one. Yeah. And the
perfect thing would be the software.
Yeah, the central, the virtual patient where everybody could look at. Yeah. I
exactly.
Can see it. So we're moving from the role of orthodontic tooth movement, which to an orthodontist seems pretty evident, to actually now, how do we make this a more interdisciplinary approach? You say there needs to be trust, there could be regional specialist networks. I then wonder, okay, so who is going to take this on? Is it just the internal drive of a professional who says, I find this important, or are there other forces at play?
I think maybe if we start practicing it will become more and more interesting also for companies to create software where everything can be done together. But maybe first they have to see a market for this. And so let's start. I guess both of us, we're doing it, but maybe not everybody's doing it.
Exactly. Well, it's a great story.
Yes, I would agree. And it's very important also to see it on a conference to make people aware there is this option. Because how our brain functions, from my understanding, is we need to see certain things work. And then we get the idea, okay, I could incorporate this in my private practice. Actually, it's not something that other people or really specialized people do. I could do it starting from tomorrow. I find an orthodontist, or the orthodontist, they find a prosthodontist they trust. They say, okay, let's communicate. We do some things together, could be nice. And I think there is this awareness. And if they see also on conferences, this interdisciplinary sessions, I think they get curious and they might be more likely to start doing this. And it's usually initiative from 1 or 2 people who think it's nice. And then they seek other experts and the network grows. You see it also with Renato Cocconi. He told today he's working with 30 offices in his neighborhood nowadays.
Exactly.
And this is something you don't build up at a day. Exactly. It grows. You start as a center, you have maybe 2 or 3 people you refer to, and then it's starting to grow and you get a network that works.
So hopefully here today, with this session that you're watching right now, we are providing a nudge in the right direction for people in the community who are watching this to start doing this. Thank you so much, Kathrin Becker, and thank you also, Manuel Nienkemper. If you're now curious, and his name was dropped here a few times already, Renato Cocconi is one of the speakers in the session. Also, Chris Laspos from Cyprus is in the session. So I invite you to go check out the full session in the Milan online library and get yourself educated based on science.